Hello and welcome to the Working Lunch, the Slow Chambers weekly series where we bring the community leaders who are doing exciting things in our community and share that with you. I'm Jim D'Antona, President and CEO of the Slow Chamber, and today we'll be having a conversation with the CEO of Tenet Health Central Coast, Mark Lisa. Mark is responsible for the strategic leadership of Twin Cities Community Hospital in Templeton and Sierra Vista Regional Medical Center, a tertiary hospital and level 3 trauma center, and only level 3 neonatal intensive care unit in San Luis Obispo. He's been instrumental in implementing lean daily management in the hospitals and leading Twin Cities to become the first hospital in San Luis Obispo County to be certified by the Health Equality Index. Tenet Health Central Coast hospitals are also the only in our region to have earned the title of the LGBTQ+ healthcare equality leader from the Human Rights Campaign Foundation. Prior to his arrival on the Central Coast, Mark served as the CEO of Doctors Hospital of Manteca and as a lieutenant from the Medical Services Corps of the United States Navy. He also served in Washington, D.C. on the staff of the Navy Surgeon General. And I'm so looking forward to learning more about Mark's leadership philosophy, how healthcare is changing on the Central Coast, and maybe even getting to hear a few stories from his time in the Navy. Mark, thanks so much for being here.
Good afternoon, James. How are you, sir?
I'm doing well. So glad to be here with you. As we sit down to lunch, where are you zooming in from today?
Jim, I'm in my home office here in Paso Robles.
Very nice. Well, I always like to start by learning a little bit more about how people's career path started. Can you take us back maybe to a 10 or 11-year-old Mark, and what was your life like and what were you interested in?
Well, I was awfully young for me to start working, but I did. So I had the fortune of growing up in a very bucolic environment in upstate New York, a little town called Oneonta, New York, which was about 22 miles from Cooperstown. That was our county seat. And Oneonta is situated on the Susquehanna River in Otsego County. So if you're a fan of Rod Serling grew up in Binghamton, just to our south. So some of his stories he wove in that small town bucolic sort of environment. So grew up in the foothills of the Catskills. My dad by that time was a retired Navy Chief Petty Officer. My mom was a registered nurse who worked, they both worked at our local hospital. I spent we have a family place on Lake Champlain in Vermont on my mom's ancestral farm property. So, basically grew up as your average everyday American kid, riding bikes, playing, going for hikes in the forest and, swimming in the river. Not sure I do that in the Susquehanna today, but basically, it was a very atypical childhood, and I'm very fortunate to have grown up when and where I did.
So family was already in the Navy. As seeing that, probably is that what helped you kind of go that route?
I think it had a big impact on us. My sister and I both joined the Navy. We both enlisted and became Navy hospital corpsmen, and I ended up staying in 20 years, and she got out after 3 or 4. But yeah, I think that had a big impact, and it's my mom was a registered nurse, and while I did entertain at one point going to nursing school or something else, I chose another path. But I went in the military, and I also went in the healthcare field in the military, so it kind of worked out.
Yeah, well, as we were talking a little earlier this week, you mentioned a set of values that you kind of live by that have clearly served you well. Would you be open to sharing some of those here?
Absolutely. And I owe it to my upbringing and my mom and dad, who instilled these sense of strong values. And I learned very early on that a good leader has a value, leads by their values. And I think we all have belief windows, and that drives us in what we do. So I have 6 values that I articulate. And when I'm, doing orientation or meeting new folks, or, used to interview for jobs, I talk about these values and that they're the basis of my leadership decision-making: results-oriented, hard work, integrity, humility, open and honest communications, resilience, and finally, but certainly not last, is fun, with a couple of exclamation points after it, because I think after all of that, we still need to be human beings.
Well, there's obviously a lot of key pieces in there that certainly I'm sure help you in the work you do, especially during a pandemic. But I particularly love that last one, which happens to align even with the slow chamber value of, oh, and we like to have fun. It's the one we also list last, but certainly not least. Maybe elaborate a little bit more on why that even made the cut for you, and why it's so important maybe in this intense life and death situations to maintain that kind of sense of humor.
Yeah, you're actually talking to a guy that was voted the class clown in high school. So not only was I our student council president, but I was also the class clown. So you tell me, it worked out, I guess. So I think, you have to have a good sense of humor. You have to be able to laugh at yourself, or at least, I think it's part of having a strong ethic of emotional intelligence, is to be able to be a human being. And I think that humor for me has been a relatively safe social lubricant. I am naturally an introvert. I'm uncomfortable in a lot of social situations. Yeah, I know, it's hard to believe, but so I tend to lean on my sense of humor, and I like to make jokes. I like a lot of professional comedy and comedians. I actually thought about that at one time. I did do an open mic night at Togo's in Pleasant Hill, California, a long time ago. And I don't think I was booed off the stage, but I don't think I was soundly accepted either. But I think having fun at work is necessary. Having fun is necessary to be a human being. I think it draws us together. I think it helps relieve stress. And I think it's very important. While the mission of the job is extremely important, especially in my line of work, I think too, having fun and being part of the work family is so important.
Well, and digging into those other pieces, and going maybe a bit further into your military service and maybe some of the leadership lessons you learned while in the Navy, you mentioned in some of our conversations the concept of facing asymmetric challenges. Maybe can you define that for us and talk a little bit about how COVID is that kind of type of challenge?
Yeah, I think that's a good segue and a good tie-in. In the military, when we talk about an asymmetrical battlefield, we're not talking about an enemy that's exactly across a front lines, and you shoot from point A to point B, or the enemy is right in front of you all the time. And now we're no longer fighting Napoleonic wars. We haven't done that for more than a century now. The modern battlefield, the modern healthcare battlefield, if you think of healthcare in the pandemic as a war, we not only had a direct threat of the virus, but we had other threats as well. We saw social unrest. We saw different views, different sciences, different politics, all having a play. And I think that when we're dealing with asymmetrical threats in healthcare, being prepared, being resilient, being able to innovate is so important. And the same thing that we learned in the military as enlisted leaders, and also later in my career as an officer. You can't be on a ship out to sea 2,000 miles from anywhere and have to be told all the time exactly what to do. You should be given a mission, and you should be given broad powers to address the mission and meet that mission. And part of the training for naval officers and Marine Corps officers, which is, I think, extremely valuable, is instilling in you the confidence and the ability to be innovative, to be resilient, because there will be victories, there will be defeats. And we saw that in the pandemic. This time last year, Jim, I thought we would have been out of the pandemic. And then I thought we would have been done by the end of July, and then in September, and then by Christmas, and so forth. Well, guess what? We're still wearing masks, and we're still vaccinating. And to add to this asymmetry now, we're dealing with a certain segment of our population that doesn't believe in vaccines. Another segment doesn't believe in masks. Another segment doesn't believe Dr. Fauci. And so it's not all, it's not all binary. There's so many factors that we've had to address in healthcare. And again, I think resiliency, ability to innovate, leverage technologies, and so forth. And really, I'll add to this final thought on that. But one of the best things we learn in the military and as leaders is the power of teams. You're not out there alone. You're out there with a crew, with a team, with a fantastic group of professionals that, they want to know the mission. They want to know the why. They're smart enough to be able to think for their own. And so again, leadership requires a great deal of presence, and you have to lead from the front. At the same time, you have to develop great teams, and you have to put yourself with them and they need the confidence in you that you're going to lead them well. And at the same time, if you do your job, you're going to be left with great teams. And I can tell you at Tenet Health Central Coast, at both of our hospitals, our physician foundation, our outpatient imaging centers, our urgent care centers, we have a fantastic group of professionals and a fantastic group of leaders everywhere in between, from our executive team to the directors, to the managers, to the shift supervisors and charge nurses. I'm so awed by the professionals that we have on the Central Coast. It's just fascinating. And that's one of the things that keeps me going too. I give you a really long answer for that, James. I'm sorry, I'll shut up.
No. I mean, that's what we want to hear, is because I really love that discussion there of asymmetry, because even if you wanted to directly take on COVID, right, you still had, as a healthcare system, you had there's still other diseases, other challenges. You still had, how did you get people in? How did you do surgeries? And so that resiliency you're talking about, and your team, right, on a ship with 2,000 people, right, you gotta rely on others, because it's not just gonna be you. I think those are incredible life lessons. So I'm so glad that you took the time to share all of those pieces, because I think it's good for our listeners to talk and hear about those things. So thank you for sharing. I do appreciate that.
Let me add too, there's some collateral damage that we're seeing from the pandemic, increased number of behavioral health patients, especially among our pediatric population. And also a certain segment of our citizens that are fearful of coming into our ERs and our hospitals for diagnostic studies, even ER for care and things like that. So again, we had to innovate and figure out ways to, how to get to these people, how to get healthcare to them rather than expecting them to come to healthcare.
Well, and I really want to dig into some of those, the innovation that you're talking about there. But first, before we jump there, I would, now obviously coming back here, you have a pretty important title. Can you tell us a little bit about what a market CEO does? Is there a typical day and what that might look like?
Yeah, well, first and foremost, my title never impresses me, so it shouldn't impress you or anybody else. I'm just one of the worker bees. I came here in 2012 in July to be the chief executive of Twin Cities Hospital only, and very proud to do so. And that's how I landed up living in Paso Robles, because I like to be close to where I work. As time progressed and the hospitals matured in our company, Tenet Healthcare, Tenet runs 65 hospitals and a lot of other healthcare delivery mechanisms. As things progressed and leadership changed, my vision for a long time had been, we have these two hospitals that are really complementary of each other. We shouldn't be frenemies. We should be working very closely together, and we should share a lot of the leadership team and so forth. And that, for the most part, has come to fruition. So as market CEO, I'm responsible for the strategic direction of both of our hospitals, of the entities that are supported by our medical foundation, First California Physician Partners, our two urgent care centers, and our two outpatient imaging centers. So we span the county, north to south, east to west. And my role is to, the strategic direction, making sure we have the people, the equipment, the things we need to do our jobs to meet the mission, and also make sure that, we're appropriately, ensuring that we have all of the resources that we're getting from Tenet Healthcare and, from the government to do our jobs and to deliver that healthcare.
Well, and you talked right there about that alignment between a nonprofit medical foundation and urgent cares, the imaging, the hospitals, and bringing all that together. Has that really, has benefited our patients across our community by bringing all those in line?
Yeah, I like to think so because, we're essentially an integrated healthcare delivery system. Well, in technical parlance of healthcare administration, that means, we have created uh, and continue to refine and create a seamless healthcare delivery system where somebody can enter, if you refer to it as a delivery system, somebody can enter the process maybe at one of our urgent care centers or an ER or through our tele ER mechanism. They can enter the system there, and then if they need to come for stabilized care at one hospital and maybe go for specialized care at another hospital, Sierra Vista, for example, we do we're a NICU, we're the trauma center. We also do thrombectomy, so we can literally pull blood clots out of people's brains and certain kinds of strokes. And now we have this clinical relationship with University of California, San Francisco for advanced neurosurgery. It should be seamless to our patients when they enter our system for care. And, quite frankly, I have to mention it. Kudos to our colleagues, across town. If somebody comes in with a cardiac issue, and they need direct intervention, we have transfer agreements with French Hospital Medical Center, and we share a lot of the medical staff between our hospitals. And so, there's a very collegial relationship, and I would say that became even better over the pandemic, working closely with my colleagues over there, Jim Malone and Julie and all of their team over there. The better we can, I refer to something as removing transactional friction. The better we can remove the friction of doing business, the friction of going to the hospital, the registration process, and then we take the fear out of all of this by creating an environment that's safe, secure, and comfortable for our patients. The better we can do that without requiring work from our patients, the better our patients will be. They'll heal quicker, they'll feel better, and there's scientific evidence to prove that when people feel safer, secure, and comfortable, they do heal quicker. And we had talked earlier this week, I call it declinicalization. There's no reason why a medically clinical space, there's laws and regulations, of course, but I'm really not a fan of white walls and harsh white lights. And the more we can make a comforting environment, and the government's coming around too. They're seeing things like that. CMS, the Centers for Medicare and Medicaid Services, are proponents now of things such as hospital at home. We worked very hard to become among the first hospitals in the country to develop a tele-ER mechanism where over this, a very similar secured platform, a patient in San Simeon or in Apomo or out on the Carrizo Plain can dial up and actually speak with a board certified emergency physician in one of our ERs and get care. And we've discovered people that we're going to need critical intervention. And so once the doctor talked to them, they said, get in here now, come to an ER. There's some things that you can do tele-ER, and not physically see that patient, but we've seen both now. We've taken care of people where they live. And we've also said, hey, you know what? Let's hang up, call 911 or get in your car and get here immediately, and we'll take care of you. And that goes back to what I said about, one of those asymmetrical factors of the pandemic, people fearing or felt that they couldn't come into the hospital and still be protected from infection and the virus. In fact, hospitals in America probably became the safest places to come to because we were taking, a lot of precautions for visitation and screening and masking and so forth.
Well, and it's a perfect transition to something I wanted to jump into, and that is, over the past 15 months, obviously we've been dealing with COVID, and you and your team have had to meet those incredible challenges. You talked about tele-ER a little bit. You mentioned UCSF. Are there changes that patients can expect into the future because of what you learned in the pandemic?
Yeah, I think, I gave this a lot of thought, and my opinion only, and I can't be an official speaker on anything, but my opinion, the pandemic has permanently changed society as we know it, locally, in the state, in the county, in the country, and then internationally as well. So we're seeing some radical shift in our society. And we are also witnessing an altered pace of change in healthcare and other things. I bet in the past couple of weeks, you've ordered groceries online, or you've ordered food online from Grubhub or Uber Eats or one of those mechanisms. Healthcare is the same thing. So we're seeing that pace of change having been impacted out of necessity by the pandemic. So these things are true. Now, I believe too, on the upside, there is an upside to the pandemic where it has pushed for logical change. It's convinced our regulators, the government, science, the industry, and I'll speak healthcare specifically, it has convinced all of us collectively that there are some things that we can do better. There are some things that make sense, like tele-ER, like a clinical affiliation with University of California, San Francisco, where we call it's a neurological microscope where one of our neurosurgeons can actively at the time be in an intracranial procedure in our OR. They can click a button or two and talk to one of the professors at UCSF in their neurosurgery program. And that professor or that doctor can see a tumor that our neurosurgeon is looking at, and they can have an active real-time consultation. And so all of these things that we've done, and we're seeing in the industry, hospital at home, more use of hospice, more use of palliative care, and so forth. I'm hoping that that change will be permanent, that the government will say, yes, this is the right thing to do. It helps de-stress people physically and emotionally. It takes the burden off of families, and that can be a permanent thing, and we're going to authorize that. So there is an upside to the pandemic. Despite all of the tragic, the things that, the deaths that we've had, the out of school, the behavioral health crisis that it's created, there is an upside. And so again, there's that asymmetry that we're talking about. And if we are facile enough, Jim, if we're innovative enough, if we're resilient enough, all of us together can work to leverage that upside rather than just focus on the downside. It's done. There's nothing we can do to change it. What we can affect now is our present and going forward. And it's going to be so important for us as leaders, you and your team as community leaders, me and my team as leaders of healthcare in the county. It's going to be important for us to leverage that and accentuate that positive and continue to push that pace of change forward for the benefit of our communities.
Well, and I love that you're talking about this partnership with UC San Francisco. And maybe if you could tell us how that came to be. I'm sure it wasn't an overnight piece. Like, I'm sure there was a lot of work that went into it, but it does seem like that will change how healthcare, some of the healthcare gets done right here in our community and raise that level.
Sure. I'll go into the history. It's about a 24-month-old history. And Dr. Phil Kissel, who had a relationship with Dr. Mitch Berger up at UCSF, who, that's a world-renowned program up there. They're nationally and internationally recognized. Mitch Berger's been the program, no longer, he's stepped down now, but he still works up there. He was the program director. We had Mitch and his team come down. We ate lunch out on the patio there of the Spirit of San Luis restaurant, and we had a really good discussion about what could be and how we would pull this off. And we determined that we were a great area for UCSF to focus on in terms of having more ability to look at the science of neurosurgery and what's happening, and having a whole nother population to go into their milieu to help their studies and help their delivery of care. At the same time here, let's face it, we're sort of an isolated insular community here on the Central Coast. So the very things that we relish about the Central Coast and that makes it so great to live here, also has its drawbacks in that if you want, typically if you wanted tertiary or quaternary care, you're going to drive several hours to somewhere else. And what's emotional stress, mental stress, family stress, physical stress. You shouldn't have to go anywhere if you live on the Central Coast to get great quality, advanced, technical healthcare. So we talked all about this, and I think the things that took the longest were getting the lawyers to sort out, what we're going to call this thing and how we're going to behave and what the billboard's going to look like. But this is a real thing. Dr. Kissel actually has an academic appointment now at UCSF, works here full time. We're going to be working with UCSF in terms of as they recruit new physicians and as we recruit new neurosurgeons to the Central Coast, there's a tie in there. And of course, the obvious real-time technical consultation and advice for our patients, which will benefit them. And, as far as, say, Twin Cities and patients in the North County, the patients that, we have already seen direct transfers from Twin Cities to UCSF. Those patients that didn't, we didn't want to wait and transfer them to Sierra Vista and then transfer up. So this also has a component of if we absolutely don't have the facility or capacity here to do something for a patient, because there are some things that need a highly technical surgical suite, we will transfer those patients. So essentially, the way I put it is we've been guaranteed beds at UCSF in their Department of Neurosurgery for our patients for whom we can't take care directly down here. So all of that, and again, that depended on the resilience of our team, the innovation of our team down here. And I have to emphasize, and I will always do this, this has very little to do with Mark Lisa. This has everything to do with the team at Tenet Health Central Coast. I can't even find the words to describe how proud I am of our professionals here, and everybody that lives here. All 280,000 of us should be very proud of the healthcare leaders that we have in our county, the doctors, the nurses, all of the technicians, all of the ancillary folks, but the leaders too, the administrators, who are very dedicated, get very little press time or face time, but they're every day, they're nose down, they're working very hard to make things happen. And I'm quite proud to be among them. And, unfortunately, I'm the face of the operation. That's not much of a thing to brag about, but I'm so excited about who I get to work with every day, because that's what keeps me going.
Well, and it's, you addressed a couple key pieces, and you did it all fabulously in talking about, seeing some of those challenges we have in the Central Coast, but finding those innovations that you're doing, whether it was the tele ER, someone in Shandon can call in, and Creston, and, without having to drive in, these partnerships, it's really fabulous. And so I see a lot of hope in the long term for our community in the healthcare sector, especially from all the work that Tenet Health's doing. So I want to make sure people can learn more about Tenet Health Central Coast. Where should they go to find out more and potentially support the organization, the foundations?
Well, we've made it very easy on people, and so we are we're part of a publicly held company, Tenet Health, and so we don't seek or ask for donations. We are funded and capitalized by our owners, Tenet Health, and so we're publicly held. I guess if folks want to buy stock, they can buy. The ticker symbol is THC, but no, people can, I encourage everybody to go to tenethealthcentralcoast.com. And I think Whitney's going to flash up the link there, tenethealthcentralcoast.com. And you know what? I'm not here as a salesman. I'm not saying, hey, you need to use us. We're the only game in town. We're not. But we're colleagues. We're all collegial. We're all working together. But if somebody wants to learn more about something, they should go to our website. But, healthcare is a personal choice. And we want people to maintain their personal choices. But, I like to feel that we offer a heck of a lot of great things to take care of our communities, to keep them well. We talked about self-obsolescence. We want to keep them well before we need to take care of them. But if we need to take care of them, we feel that we have the services and the people and the professionals that we need to take great care of our community. We're committed to that. We've been here for 60 years, and we're going to be here for the next 60 years.
Well, and I would say it's so important to our community. It's why we love having this conversation, is because it's important for all of us to have a strong healthcare system as we're trying to build a healthy economy and get staff and talk about all these challenges. And, we run into incredible challenges like a pandemic, and your team and the team at Tenet Health did an amazing job and continues to do an amazing job. So we're always so thankful for that work. But we're already at our half hour. So I want to end our program like we do every week and ask you, what are you looking forward to doing this weekend?
Now, another complaint I have about the Central Coast is that there's so darn much to do and the weather is so great all the time. And if you want foggy and cool right now, you go to the beach. If you want warm and sunny, you go to Paso Robles. So we have a choice. I know tomorrow we're going to go zip lining. So that's always exciting. And I think we'll probably do a little bit of hiking. I'm an amateur architectural archaeologist. So I like to go figure out things, go take a look at old cinnabar mines, like up at Rinconada, or go out to the old Slack Canyon conservation camp, an old prison. There's an old railroad I'm trying to find called, I think it's called the Black Rock Canyon. There used to be a coal mine up north. And so I like that sort of thing. I like where hiking takes me and biking. I like to fly. I like to ride my motorcycle. So there's too much to do, Jim. Help me. Thankfully, I have work to go to every day, so I can do that.
This is why I love that question. Is I just learned a ton of things that I had never heard of before that are just going to be part of my weekend. So
call me. Want California history trivia, I'm happy to give it to you. Now, I want to give a shout out. I know we got to go, but I want to give a shout out to you and your team. One of the mantras I learned a long time ago from one of my Navy mentors is that all of us together are better than any one of us. And certainly the work that you and your team does at the Chamber helps advance that, especially, you're using a platform right now that you hadn't done before. And so your reach can be worldwide now using this venue. And so congratulations on that, because more people will learn about what you do, what we do, but all of us together are certainly more important than and more capable than any one of us. And you all, the Chamber, is a big part of that. So congratulations for your innovation and your resilience. Great job. Except for as a guest, there's always misses.
Well, thank you, Mark, for that. But again, like you said, I got an amazing team that came up with this idea, because again, we really appreciate the partnerships that we develop here. And again, the great work you and your team are doing. You guys have been there all along for the Chamber, for our community, and really appreciate you sharing your story, your leadership discussion that, again, helps all of us get better. So again, to you and the team at Tenet, thank you so much for all you do.
Take care. Thanks, Jim.
Fabulous. As always, if you have questions for our guests, feel free to add them into the Facebook comments below, and someone from the Tenet team is already there, but they'll hop on and try to answer them when they get a moment. And thank you so much for everyone tuning in. Hope you'll join us next week, where we'll be talking to Aaron Steed, President and CEO of Meathead Movers, about starting his own company. He's growing it to be a regional leader, and what he's doing today to build a better equipped workforce that will help our whole region. Thanks for tuning in. We hope you have a wonderful weekend. Stay healthy and safe out there.